Hello everyone, I'm Dr. Rishabh Goswami and I was watching a series named The Code Black, and it really impressed me because most of the scenes that are depicted in that movie actually mimics what the scenario is in emergency department. So let's take a look in some of the scenes of this series to improve our knowledge.
75-year-old male started speaking gibberish at dinner.
So one of the symptoms of stroke is um talking gibberish, which means that the patient tries to speak something normally, but the speech output is totally messed up. So why this occurs? Because in case of cerebral stroke, usually the dominant hemisphere, which is left hemisphere in most of the population. So if there is a MCA territory, middle cerebral artery territory stroke, um, the Broca's area, which is the motor area responsible for the speech, gets disrupted and gets damaged, because of which the patient tries to speak normally, but the speech output that comes out is absolutely nonsense and messed up. Also, as there is no history of symptoms which are related to raised intracranial tension, such as vomiting or severe kind of headache, we can rule out hemorrhagic stroke. Most likely this is a case of thrombotic or thromboembolic stroke of the left middle cerebral artery territory.
He's gonna need TPA.
Dr. Layton.
He was confused that I didn't understand him.
Yes. Called expressive aphasia. It's word salad. Sounds right to him, but the words come out all tossed around.
Activate the stroke team, please.
Young Squire, I heard you mention TPA.
So what they are talking about here is a tissue plasminogen activator, TPA, which is a thrombolytic agent which we give in case of a thrombotic or thromboembolic stroke, and it is given intravenously, and it needs to be given really early when the symptoms occurs. So here there is an important message that in case of stroke you need to bring the patient as early as possible to the hospital, because if there is a thrombotic or thromboembolic stroke or even a hemorrhagic stroke, the treatment needs to be started urgently, because here we say that time is brain, and if the treatment is not started early, the brain cells dies and they cannot recover, causing a lifelong impairment of certain functions of the brain. But before we start with the TPA, we need to confirm that it's a thrombotic or thromboembolic stroke, because if it's a hemorrhagic stroke, which means that there is a bleed in the brain, then the bleed can get worse. So initially we need to get a CT head, CT brain done, CT scan of the brain, to rule out that it's not a hemorrhagic stroke.
That what you think?
Sides North 4, 8:55 p.m.
Yes. The symptom profile suggests MCA distribution.
I think so too. Fingers crossed. Okay, Mr. and Mrs. Cleary, TPA is a kind of miracle drug.
So let's talk about TPA, tissue plasminogen activator. The window period for the TPA for thrombolysis is usually 3 to 4.5 hours, but which means that once the symptoms have occurred, you need to bring the patient within 3 hours to the hospital. And also if 3 hours has passed, still try to bring the patient to the hospital as early as possible, because still the treatment can be given. But within 4.5 hours, if we thrombolize the patient, it's the best for the patient, and the recovery will be much better. Also, we say that the door to needle time should be within 1 hour, which means that once the patient enters the hospital till we inject tissue plasminogen activator, the time frame should be 60 minutes, which means within 60 minutes we have to take history from the bystander, we have to examine the patient, we have to diagnose the problem, we have to take a CT scan to rule out if there is a hemorrhagic stroke. After that, we need to prepare the patient for giving alteplase, which means the TPA, and within 60 minutes we need to inject TPA for best outcome.
that has the potential to bust the clot up and reverse the stroke. But only if there's no actual bleeding yet in the brain. We're gonna need a scan to know for sure.
It doesn't take 12 people to run a scan. Come on, folks, it's Friday night. Let's divide and conquer.
You qualify for TPA, and we're still inside the window for it to be effective.
What are the complications?
Only 7% experience the miracle. However, the same number experience catastrophic bleeding somewhere else in the body.
So as TPA is a thrombolytic agent, it definitely have its own problems. Major side effect here is of bleeding, and there is a criteria. First, score the patient whether he has risk for a major bleeding or not, and then only we give TPA. But still there is a danger of having a severe bleed which can be torrential for the patient. But in such scenarios, in such emergencies, please just trust your doctor and don't try to put in your knowledge, because your questions and answering those questions is taking time, and in such scenario, time is equal to the brain.
We wouldn't know where until it was actually happening, and we might not be able to stop it.
And if we do nothing?
What you see now, and possibly worse.
PA has a short window.
How soon will we know if it worked?
Just takes a few seconds when it works. Come on, baby. Show us the magic. Mr. Cleary, I want you to try and speak.
Love you.
Once the TPA is injected, the clot that he had in the artery of his brain is now lysed, and the blood flow is continuous to his brain again. Now what we see is not less than a miracle, because he is again able to speak what he thinks in his brain.
Abracadabra. That's why we're here, young squire. Never forget that.
One of the most happiest person here is the doctor, because he knows what can be the consequences of a stroke, but once the patient recovers, in this case completely after a stroke, he is one of the most happiest person that is there in the emergency room. I hope you enjoyed the video, and thank you for watching. I hope that you gain some knowledge, and if you are a medical student, then definitely it will help you and your patients in future life. Thank you so much.